tikulandileninso kuchigawo chino chamasana pompano pa Parliament Broadcasting pamene tikupitiliza kukupatsirani zokambirana za phungu a nyumba ya malamulo za lero lachiwiri pa 7 July 2026 kummawaku maunduna awiri anapereka malipoti awo mnyumbayi. Aphungu akhala kupitiliza zokambirana zawo posachedwa apa. If you're just tuning in, welcome back to the afternoon segment of the live coverage of the third ordinary meeting in the 52nd session of Parliament, today 7th July 2026. Earlier in the morning, the House tackled two ministerial statements and business resumes shortly. My name is Rachel Conani. Stay tuned.
Yes, Leader of the House.
Good afternoon, Right Honorable Speaker. Like I did in the morning this time, I also want to beg that the order paper be varied in order for us to tackle government business C subsidiary registration.
Leader of the House, we had supplementary questions.
Right Honorable Speaker, I'm sorry. I have jumped the gun. Forgive me. I think at the time we were breaking for lunch, the Minister of Local Government and Rural Development was supposed to answer questions, right? Yes, so we will, I'll yield the floor to the Minister of Local Government to deal with that item, and after that, we'll move to the next business. Thank you.
Thank you, Leader. Minister of Local Government, I'm sure you are ready now.
Thank you very much, Right Honorable Speaker, and good afternoon. Allow me through you to thank the Honorable Member for Lilongwe Site Lumbadzi for his question. I had a few questions, and my response would be as follows. He was worried that since April, now it's July, nothing has been disbursed. I am pleased to let him know that disbursement started flowing. As you're well aware that we needed a bit of capacity within our councils, and we provided, the Ministry of Finance provided resources for the foundation of the same. And at the same time, the orientations that we were doing was part of the same within the same structures. Officers are now in place, and we provided resources as well for the procurement processes which have started. I am pleased to report that councils like Zomba City Council, for example, is now at an award stage. Other councils have done bit of quantities. As indicated, we would want to have uniform structures in terms of quality. They must be uniform. At the same time, Right Honorable Speaker, we are trying to make sure that we've got a guiding figures, because you find that in District A, there is a price tag that one would wonder whether they are going to Mars or not. So at central level, we have tried as well to expedite standard BOQs for certain projects, again, resources flowing. That said, once they do the procurement, and before I get there probably, the youth and women empowerment resources have already been disbursed, and they now are sitting at the MADEF offices, and orientation, as indicated, will start anytime soon, and that money is indeed gone, and it is no longer with Ministry of Finance. But immediately, when it comes to the infrastructure, immediately the contractors have been awarded the contracts. The Ministry of Finance Emeritus will tell you that they release what they call 20% mobilization fee. Then after that, it will be certificate-based payments. Otherwise, he will tell you as well, getting the money, dumping them with the district commissioner, and then you will find that the contractor is slowing down. The resources would have gone somewhere else to do the needful whilst we're waiting for the contractor to move. So it's not like when we pass the budget in here that the government has already collected the revenue and it's in one room. No, they keep on collecting and then they spend as and when. There is therefore no reason why the resources should be dumped at the council as they are doing procurements and other things. When they are awarded, they will be given the 20% mobilization fee, and then upon production of certificates, then they will be paid. And you can rest be assured that there will not be delays in payments. Upon production of certificates, everything will flow. Then there was a question where the honorable member wanted to have contracts. No. You can't, contracts, no. Oversight, yes. The transparency will come on the project signboard, where it shows you the name of the project, who is the client, which funding are they using, and what is the amount of the project, and what is the implementation period. That's how it goes. But a legal document between that and that, it will only come in case of something. Otherwise, be assured we'll be as transparent as we can. Otherwise, we can't say members of parliament begin to have copies of contracts that the contractor has signed with the council. Then we will create a case. Nkata Bechinteche raised a question that was even supplemented by Mzimba West. The question is to do with the project that have so far stalled. There were mentioned of projects like clinics, schools, some of which were funded by the government and some by the donor community or partners. I am pleased to report that we have requested all district councils, because in the guidelines, we mentioned that the continuation of stalled projects is allowed. So what we have done now, Right Honorable Speaker, is to request all district commissioners to submit to our ministry the project, the name of the project, the status as it stands now, who was funding that particular project, so that at least then we can reassess and determine and give them a bit of a guidance on how they want to complete. But you can rest assured that these stored projects will be completed and they will be allowed, and they are allowed under the same. It's just a question of making sure that we do things orderly. Right Honorable Speaker, allow me to point out, Dedzakasina hinted whether as a commercial break or otherwise, that the government is blocked. No, the government is not blocked. It's not blocked. The government is okay, and it's being run, and it will continue to run. Yes, we are facing turbulences, but it doesn't mean that projects are not running. I think it's unfair to say that the government has completely no money. But he did ask questions of estimates, because you will find that there is a bit of inconsistencies when it comes to project pricing. What we have asked the district councils is to come up with project implementation plans, procurement plans, and again, they should make sure that they have assessed the project very well, considering the climate changes and climate shocks that we're having. Now, Honorable Speaker, let me invite you to the following. There are times that we look at a bridge and think that it is just 2 meters from a layman's point. When a technical person comes, that's the more reason why we have sent engineers to almost all councils in Malawi, because when an engineer gets there, they do soil tests, they discover that the soils can easily move. with any shocks that happens. As a result, the engineers would decide that the bridge, instead of being 2 meters, they would put it probably 3 or 4 meters to accommodate that sort of earthquakes that will happen. Now, from the layman's point, you would think that this is worth 20,000 kwacha, when they think that the foundation has got to go maybe 2 meters deeper than what you think. So all those have resulted in us thinking of doing standard BOQs that will only be varied on the basis of terrain and otherwise. So you can rest be assured we have taken into account that there are people who are clever. They want to try to give in prices that are out of this world. That will be taken care of. How do you make sure that contractors are paid in time? Over a period. This House knows very well that if there is a funding that has been religiously been disbursed, is none other than CDF. CDF has been religiously disbursed. But this disbursement this time around will be certificate-based, and you can be assured that those will be honored and your projects will not fail at any time. The last question from Cassina was whether the South African colleague friends who are coming back, the promises that are being made are within the CDF. It will be difficult for me to respond to that question because I have not made that promise, and the guidelines are very clear. I should think that either the Ministry of Finance or any other ministry who are directly involved with our friends and family will be able to respond to that question. And finally, Right Honorable Speaker, Zomba Malosa did raise a very important question to do with the hand reshaping of roads. As you're well aware that the guidelines did indicate that 72% of the resources that we have been put will be channeled towards infrastructure development. Our desire is to make sure that we are improving our roads to at least gravel standards or even abutment standards. But there will be, and there are other roads that connects from one village to the other, ambulances do pass by, that probably may not qualify. We have talked with the Minister of Finance, and I will be coming up with a proper official position on the same, but you raised a very important question, and will be answered to properly, considering that most of our areas do have such roads. In other words, that will be accommodated within the community managed projects. And that the minister will help us on how much that should be accommodated. With that, Right Honorable Speaker, I thank you. Those were the questions that I had. Thank you, Right Honorable Speaker.
Honorable Minister of Local Government, thank you. Are you willing to take another 3? Thank you. Let me get leaders' blessings first. Another 3, I've got a line here. Okay, thank you, leader. Let me start with Sanje Central. Honour members, let's be quick with our questions or submissions so that we give also others a chance to speak. Sanje Central, you have the floor.
Thank you, Mr. Speaker, sir, for granting the people of Sanje Central to comment on the ministerial statement presented to the House by the Minister of Local Government. Mr. Speaker, sir, firstly, to appreciate the information that has been provided by the Minister to the House, and it will help us a lot as we move forward with the CDF. One comment that I had, Mr. Speaker, sir, is in relation to the 3 officers that will be based in our constituencies. So far, there isn't a link between the Constituency Development Committee and the 3 officers. They are supposed to report directly to the councils. I had thought that probably the minister could look into it and see how we will relate with the 3 officers at that local level. They are very key in supporting the communities. Without that link, we may create a little bit of some friction. Thank you, Mr. Speaker, sir.
Thank you, Sanje Central. Chinji Northeast.
Thank you, Right Honorable Speaker, sir. And thank you, Local Government Minister, for the elaborate submission to the questions asked by the honorable members here. Honorable Minister, I would like to first of all appreciate the amount of job that has been put into the preparations of the CDF. It's a quite commendable job, and that we must applaud you for that. But I'm a bit worried in the sense that, the CDF was a very brilliant vision, and I'm using was deliberately but also cautiously. I'm worried because of the timelines. So we've been discussing here and that, but the timelines are not coming out very clearly. When are we starting the actual implementation? The other issue, Honorable Minister, is that, there's silent rising of costs here. So the district councils came up with the BOQs and the estimation of the prices and so on and so forth. By then, we are not coming out clear on the timelines. What if we start implementing 2 months from now? How are we taking care of the silent rising of the costs? That, again, you need to come out very clearly, because we could be thinking of 5 billion now, but it will no longer be 5 billion in 2 months' time because of the silent rising of the cost. Thank you very much, Right Honorable Speaker, sir.
Thank you. Lastly will be Nkatabe North. You have the floor now.
Thank you, Honorable Speaker, for giving people of Nkatabe North to ask a question to the Minister of Local Government. Honorable Speaker, or Honorable Minister, is the Ministry aware of widespread complaining from men in the various constituencies, like mine in Nkatabe North, that they are sidelined in accessing government loan? So what measure is the ministry putting in place to ensure that our men in this country, they are also considered to access the loan? Thank you.
Thank you, Honorable, with that question. Honorable Minister of Local Government.
Thank you very much, Right Honorable Speaker. And through you, allow me to thank the Honorable Member from Sanje Central for his question. Let me assure the Honorable Member through you that in the contracts that the these constituency development staff will be signing, and which will include their job description, will have the reporting lines as well very clear. Obviously, they will be working directly with the CDCs, but they will be answerable to, for example, if it's a constituency accountant, will be answerable straight to the council as well, the director of finance, through the cadres, whether it be chief accountant and the like. The work supervisor, the same. So all that will be clear in the contracts that they are signing when they are given job description and reporting lines. So you can rest assured there will not be any challenges within that particular one. Thank you very much. And then I have got in Chinji Northeast, talking about timelines. The question of timelines goes together with project implementation plans and project procurement plans. I can assure you from the plans that we have, we are okay. We don't have any problem. And I'll tell you why we are saying that. They were given, each council was given an opportunity to do a project implementation plans and project procurement plan. Until this day, no council is out of the project procurement plan. None. All of them are within the times that were set. Number one. Number two, be assured as well that within the guidelines, there will be projects that must be done within one financial year. There will be other projects that will allowed overlap. For example, if you're constructing a secondary school, you cannot construct a secondary school, even if the contractor was good enough, but you're considering other variables. You'll find that rents would play a part and all sorts of things. You'll find that probably the construction period is between August to somewhere, stop and then get to something. It's a few months that one has got to implement your project. So you can rest be assured. Usually you would not send a contractor into the field during the rainy seasons. So we use this period specifically for procurements and we're on track. So be assured, certain projects will be allowed to overlap. Some projects will have to be completed within that period. That's why on the notice, on the project implementation board, it will show you what was the project implementation period. If it was 6 months, when did it start and when is it ending? Then your other question was to do with price escalations. That again, there are a lot of variables that really informs the same. But one thing that you can be sure of is that at the moment, it looks like there have not been a lot of changes in terms of inflation. So we are sure that if you are buying a bag of cement now, unless something happens, that will be the price in January. But in any project, you can't run away from such because there will be reasons why such will be allowed. That said, as a ministry, we have put up measures to control unnecessary, crooked sort of price escalations because there were other people that were just busy making sure that a project should be delayed. Then they push up numbers for the benefit of themselves. So you can rest assured that that one, we are okay. Again, I want to reaffirm my area position that most and some of the projects, depending on the implementation period, will be allowed to roll over. So you can rest be assured that you're not going to be losing out. Finally, on your question, every council is aware that this is not just like a grant as it was. This is performance-based grant. Because it is performance-based grant, all the councils know that they must make sure they conform to the plan that they've laid bare to us, and indeed within the dashboard that will be launching soon, it will be clear there, and everybody will be able to see that this is off the rail, this is within. And finally, I have Nkatabe North raising up a pertinent question. I am my ministry is an implementing agent. The owners of the PES is Minister of Finance. I will take your question to the Minister of Finance and then we'll provide a proper response at an appropriate time. Thank you, Right Honourable Speaker, for the opportunity. I thank you.
Government whip.
Right Honourable Speaker, I beg to move that debate be curtailed in order to allow the House to consider other business. I thank you.
Whip, I wanted to guide that it's questions, not debate. Therefore, you don't have to curtail, but you can advise us on what to do. But before you do that, Whip and Leader, I wanted to bring to the attention of the IT guys, that Honorable Minister of Local Government, the name showing there is not his. I know my brother very well. Also Minister of Health, the name that's showing on the machine is not belonging to her. Whip, where you are sitting also, I hope it's on your chair.
Right Honorable Speaker, mine has the correct name. Thank you.
It's showing me Honorable Martha Mzomera, where you are seated.
That's definitely a technical glitch. Honorable Nzomela Ngwira is my neighbor.
Yes, that's what I want to bring to the attention of our technicians, that this needs to be resolved today after we adjourn. You want to guide us?
Yes, Right Honorable Speaker, with your indulgence, I wish to, but before I proceed, Right Honorable Speaker, I wish to congratulate you because today you have not one, but two deputy speakers covering you. So you have full backup. Right Honorable Speaker, I beg to move that the order paper be varied in order to allow the House to tackle government business C1 subsidiary legislation. I beg to move.
Thank you, Whip. Honorable members, we have a motion on the floor as said by the Whip. The motion is to vary the order paper in order for us to tackle government business and subsidiary legislation. Those of that opinion say aye. Those of the contrary view say no. The ayes have it and the motion is carried.
Government business, item 3C, subsidiary registrations.
Honorable Minister of Transport, who's also leader, I was looking at the items and they all belong to you, to your ministry. Would you prefer doing them at once or we go individual? We do it as a bunch. Okay. Honorable Minister of Transport, you may proceed.
Right Honorable Speaker, I beg to present the papers standing in my name under item 3C, 1, 2, 3, 4, 5, 6, and 7. I beg to present.
Thank you, Minister. Sergeant at Arms. Honourable Minister, do you wish to speak to your papers?
No, Right Honorable Speaker, but the papers be referred to the relevant committees. I thank you.
Thank you, Honourable Minister. The papers will now be referred to the Legal Affairs Committee. Leader?
Right Honorable Speaker, as guided by the Chief Whip, we will now proceed with item number 2, that's the Minister of Agriculture, Education, and Water Development.
Minister of Agriculture?
Thank you, Mr. Speaker, sir. Mr. Speaker, sir, I beg to present the papers standing on my name under item 3C, 2, items 1 and 2 of the order paper. I beg to present, Mr. Speaker, sir.
Thank you, Minister of Agriculture. Sergeant at Arms? Thank you. Honourable Minister of Agriculture, do you wish to speak to your papers?
No, Mr. Speaker, sir, but that the relevant committee should handle the papers. Thank you, Mr. Speaker, sir.
Thank you, Honourable Minister. The papers will be referred to Legal Affairs Committee. Thank you. Leader is the next minister.
Right Honorable Speaker, we now move to item 4, the Honorable Minister of Natural Resources to lay the papers.
Thank you. Honourable Minister of Natural Resources.
Right Honorable Speaker, I beg to present the paper standing on my name under item 3C, 4 of the order paper. I beg to present.
Thank you. Sergeant at Arms. Thank you. Honorable Minister, do you wish to speak to your papers?
I'm afraid not, Right Honorable Speaker. However, I wish to request that the paper be referred to the relevant committee.
Thank you. Honorable Minister, the papers will now be referred to the Legal Affairs Committee. Thank you. Leader, who's the next minister?
Right Honorable Speaker, we now move to papers under the Ministry of Labor, Skills and Innovation.
Thank you, Leader. Minister of Labor.
Thank you, Mr. Speaker, sir. I beg to present the papers standing on my name under item 3C 511 of order papers and 3C 51. I thank you.
Thank you, Honorable Minister. Sergeant at Arms. Thank you, Sergeant at Arms. Honorable Minister of Labor, do you wish to speak to your papers?
Thank you, Mr. Speaker, sir. No, because it's already been gazetted. I thank you.
Honorable Minister, you should move that the papers be referred to the relevant committee.
Yes, Mr. Speaker, sir.
Thank you, Honorable Minister. I take that one was I beg to move. Thank you. Therefore, the papers will be referred to the Legal Affairs Committee. Thank you. Yes, Government Whip.
Right Honorable Speaker, I beg to move that the order paper be varied in order to allow the House consider general business questions to ministers for oral replies. I beg to move. Starting with Ministry of Health and Sanitation. I beg to move.
Government Whip, please come again. You said we should vary the order paper and go back to. Beginning with health. Okay. Honourable members, we have a motion on the floor to vary the order paper again in order for us to go back to general business under Ministry of Transport, questions to ministers for oral replies under Ministry of Health and Sanitation. Those of that opinion say aye. Those of the contrary view say no. The ayes have it and the motion is carried. I see point of order. Is that a point of order in Chinchisa?
Yes, it is. Yes, it is a point of order, Mr. Speaker, sir.
Nchinji South, did you raise a point of order?
Yes, yes, Mr. Speaker, sir, it is a point of order.
Thank you very much, Mr. Speaker,
Okay,
sir.
I take it we have one in Nchinji South in Malawi. Which is in Nchinji South? Honorable Kema Banjira, yours is Nchinji what? Honorable Nchinji South, proceed.
Thank you so much, Honorable Speaker. I'm indeed rising on the point of order. The question time to the Ministry of Local Government was curtailed to allow other business to go ahead. But my rising is that I'm asking if that can also come back, because the issue which was on the floor is very, very important about the CDF, and people are looking forward to it. So curtailing actually questions going to the Ministry of Local Government will not do us better. There were other people who were rising, wanted to ask the Ministry of Local Government for clarification of the same. So I'm pleading to the House if they can allow those who had questions to the Minister of Local Government to proceed with their questions. Thank you so much. I so submit.
Thank you, Nchinji South. Unfortunately, the matter has already been decided, but in good faith, I know the Honorable Minister of Local Government will come as we are going. We have enough time. I'm sure at some point he will come and say something. We know how important this issue is, and the minister is working day and night to solve this. I know about that. So he will come and explain more if we need him to. If it's very important, you can put it in writing straight to the minister, and I'm sure he'll attend to that. Thank you.
General business, item 2B, questions to ministers for oral replies.
Honorable Minister of Health and Sanitation. Question number 69. Sorry, Honorable Minister. Kasungu Municipal. Please confirm question 69 in today's order paper going to the Ministry of Health. Kasungu Municipal. He's not in. Kasungu Municipal, are you in? All right, we will pen that one. Let's now move to Mwanza Central. Mwanza Central, are you in the house? Question number 70 in today's order paper. Not in the house. We'll go to question 94. Chitipa North. Yes, Honorable Chitipa North, please confirm.
Indeed, Right Honorable Speaker, I rise to confirm that the question appearing in today's order paper, number 94, indeed comes from the people of Chitipa North constituency. Thank you. I submit.
Thank you, Chitipa North. Honorable Minister of Health and Sanitation.
Good afternoon, Mr. Speaker, sir. Mr. Speaker, sir, I would like to thank the honorable member for Chitipa North, Honorable Fales, for the question, and the question reads, the question is to ask the Minister of Health and Sanitation to consider providing 2 ambulances to 2 health centers in Chitipa North constituency to ease transportation challenges met by referred patients who are currently ferried using motorbikes. The health centers are as follows: Kameme Health Center and Kapenda Health Center. Mr. Speaker, sir, through you, my ministry is aware that Chitipa District Health Office operates 6 clusters for ambulance services. One of these clusters covers Kapenda, St. Cynthia, and Kameme Health Centers, all located in Chitipa North constituency. St. Cynthia Health Center, being a CHAM facility, has its own ambulance. Kameme Health Center is situated approximately 32 kilometers from Chitipa Boma, while Kapenda is about 31 kilometers away. The 2 facilities have catchment population of 29,411 and 18,813 respectively. Currently, 1 ambulance serves both facilities and is stationed at Kameme Health Center. This ambulance facilitates the referral of patients from both centers to Chitipa District Hospital. Mr. Speaker, sir, my ministry acknowledges the challenges faced by the health center and the facilities that have been mentioned. I wish to inform the August House that the possibility of assigning an additional ambulance to be based at Kapenda Health Center has already been considered and included in the district development plan. Mr. Speaker, sir, in addition to that, my ministry has allocated a budget in the 2026-2027 financial year for procurement of ambulances. Once the ambulances are procured, allocation will prioritize facilities experiencing critical transportation challenges, including those in Chitipa North constituency. Furthermore, Mr. Speaker, sir, my ministry intends to leverage opportunities presented under the new CDF to support the procurement of ambulances for the underserved facilities. I thank you, Mr. Speaker.
Thank you, Minister of Health. Honorable Member, I should have used your gadget. Thank you. Let me start with Lilongwe Zimsinja.
Thank you, Right Honorable Speaker. My question is about the human resource at Ben Health Center. We cannot talk about ambulances without talking about nurses, doctors at the center. We constructed the Ben Health Center using GSET, and it's covering 2,000 villages. But as at now, the policy ratio of a nurse to patient is very high. I wanted to know, in your planning, are you planning to send more nurses and doctors at the Ben Health Center so that when patients visit the health center by motorbikes, they need to find nurses and doctors at the health center. Thank you, Right Honorable Speaker. Thank you.
Thank you. Let me go to Nkatabe Central.
Thank you very much. Right, Honorable Speaker, sir. First, I would like to thank the Honorable Minister of Health because she personally visited my constituency. She visited Bwelero Dindan Clinic. Right, Honorable Speaker, sir, I would like to report and ask the Honorable Minister of Health in a supplementary question that, Madam Minister, the project you visited is up to now abandoned. It was being funded using the American government presidential initiative. I want to ask you, Madam Minister, whether you can support us by lobbying for resources to complete the construction of Bwere General Clinic as well as Total Clinic, as well as to ask a supplementary question whether you can help us to solicit for a boat ambulance to enable patients move from the main Nkatabe, this hospital, to areas like Toto, where there's no road network, they're traveling by boat. A boat ambulance is necessary. We budgeted for an ambulance in the CDF, but as you have heard, that funding is not in yet. So I want to ask you, Honorable Madam Minister, for a boat ambulance for Total Clinic, as well as financial resources to complete the construction of Total Clinic and the Bwerero Dindane Clinic. Thank you, Madam Minister, Madam.
Thank you, Nkatabe Central. And if that materializes, we get that boat, we should name it a Davua. Members, I have one more. Zuzu City South.
Thank you very much, Honorable Speaker, for recognizing the people of Mzuzi Southwest to ask a supplementary question to the Minister of Health. The people of Mzuzi Southwest want to find out from the Honorable Minister on the status of the procurement of the dialysis machine from Mzuzi Hospital, because it's an issue of HSS, so want to find out the status at which point are they. Thank you very much.
Thank you, Honorable Minister.
Thank you so much, Mr. Speaker, sir. And through you, let me thank Lilongwe Sinja South for the question to my ministry, where he's asking about the human resources issue on a health center that I failed to capture the name in his constituency. Mr. Speaker, sir, let me ask the honorable member to write the request officially so that I can find out how best we can assist the people of Lilongwe Sinja South and what the issues are with this health center, since he asked the question under a question that was not related to human resource area. I would also like to thank Nkatabe Central for asking my ministry. Indeed, it was a great honor when I visited his constituency, where I inspected this project. And Mr. Speaker, sir, through you, let me indicate here that this clinic was being constructed under the presidential initiative on maternal health, and this was included in the budget, and the funds are available. And once again, I will make sure that I follow up and provide response directly to him to see where and how and the reasons that has led to the project stalling reaching this far. Mr. Speaker, sir, let me also thank the honorable member from Zuzu Southwest for his question on the status of the procurement of dialysis machines in Zuzu. Just to update the August House that indeed my ministry is in the process of procuring dialysis machines, and he has already set up space, construction, everything is already done. We are in the process of procurement of the actual machinery, and the funds for this activity were included in this year's budget, and everything is under control. Soon he will be appraised on the status of the dialysis machines in Zuzu. And just to indicate that this is also a priority for the ministry, considering that Zuzu Central is one of the central hospitals that currently do not have a dialysis unit within the central hospital. It is a priority for the ministry. Thank you, Mr. Speaker.
Thank you, Minister of Health. You have responded well. Let's now move to question 95 coming from Cholo Goliati.
Good afternoon, Mr. Right Honorable Speaker, sir. I rise to confirm that the question appearing on the today's order paper, question number 95, is indeed coming from the people of Cholo Goliath. I confirm.
Thank you, Honorable Minister.
Thank you so much, Mr. Speaker, and through you, let me thank the honorable member for Cholo Goliath for her question. And the question is to ask the Minister of Health and Sanitation on the status of incomplete hospital building at Ngongoliwa in Cholo Goliath constituency. The Ngongoliwa Hospital has been in deplorable state and has stalled since 2020 and has left the community without access to essential healthcare services. I therefore request the Speaker to consider facilitating the completion of Ngongoliwa Hospital during the forthcoming budget. Mr. Speaker, sir, I would like to thank, sorry, I've thanked her already. Mr. Speaker, sir, construction of the Ngongoliwa Health Center was halted in 2020 when the overall progress had reached approximately 40%. Mr. Speaker, sir, my ministry recognizes the importance of this facility and the challenges faced by the communities due to its incomplete state. I wish to inform this August House that the ministry's integrated capital investment plan prioritizes the completion of unfinished health infrastructures, including Ngongoliwa Health Center. Currently, my ministry is actively mobilizing resources to ensure completion of this facility. Mr. Speaker, sir, I would like to encourage the honorable member to consider prioritizing it under the CDF whilst waiting for the ministry to consider in the mobilization of resources. I thank you, Mr. Speaker, sir.
Thank you, Minister of Health. Neno East.
Thank you so much, Right Honorable Speaker, for giving people of Nano East the chance to ask a supplementary question. I would want to know from the Minister of Health the criteria used in order to construct a community hospital. I have in mind an area called Kanono, where people walk a distance of 13 kilometers to reach the nearest hospital at Matope. This makes pregnant women fail to access maternity services because of a long distance. As a result, maternal death is so high in that area. I submit, Right Honorable Speaker.
Thank you. Neno, we go to Chitipa Central. After Chitipa Central, we go to Lilongwe Site Kampuno. In that order, please.
Thank you, Right Honorable Speaker, for recognizing the great people of Chitipa Central. The people of Chitipa Central would like to know the status of rehabilitation of Mero Ward at Chitipa District Hospital. Mr. Speaker, sir, the situation is very terrible because it's cold and our patients are sleeping on corridors. I submit.
Lilongwe Kampuno.
Thank you, Right Honorable Speaker, for granting the beautiful people of Lilongwe Kampuno constituency to give a supplementary question to the Honorable Minister of Health. Firstly, let me thank you, Honorable Minister, for opening a health center in Chisapo 2 weeks ago, if I'm not mistaken. It is obviously in Baira constituency, but it is also helping other people, few residents from Lilongwe Kampuno constituency. But we need, if you may help us with a maternity wing on that health post, because in Kampuno constituency and Baira constituency, we still have few women who are delivering at home because of lack of transport, of going to Baira. And they don't have enough money to pay at Likoni Mission Hospital. Now delivery only is about 120,000. So a lot of women, they don't have that enough money to pay there. So if you can manage to give us a maternity wing at that health center. Thank you so much, Honorable Minister.
Thank you, Lilongwe Kampuno. Minister of Health.
Mr. Speaker, sir, through you, can I ask the Honorable Member for Chitipa Central to repeat his question? Thank you.
Chitipa, was it Chitipa South?
Central.
Central.
Yeah, Central.
Yeah, please repeat the question.
Yeah, thank you, Right Honorable Speaker, sir. My question was on rehabilitation of the Mero Ward at Chitipa District Hospital. The rehabilitation started, I think, 9 months ago. To date, it stopped, and patients are sleeping on corridors, some actually outside covered by tents. So I was asking the status today, after 9 months, nothing is happening. Thank you, Honorable Speaker, sir.
Thank you. Yes, Honorable Minister of Health.
Thank you so much, Mr. Speaker, sir. And through you, I would like to thank the people, the beautiful people of Lilongwe Kampuno, for their question and also for appreciating just 2 or 3 weeks ago when we were opening a health center in Chisapo. And indeed, as the honorable member has mentioned, there is need for a maternity wing, and because currently the people are paying for just to attend, just to be attended at the maternity and also for delivery. Mr. Speaker, sir, through you, I would like to assure the people of Lilongwe Kampuno that the maternity wing is integrated into our capital investment plan within the Ministry of Health. However, Mr. Speaker, sir, as the honorable member is already aware, um, resources have been decentralized to district councils, and I would like to encourage the honorable member to continue prioritizing the maternity wing through the district council and also to capitalize the CDF that has been allocated by our president through the councils. Mr. Speaker, sir, I would also like to thank the honorable member for Chitipa Central for his question. His question is to ask the ministry where on the status of the rehabilitation of male ward at the moment in Chitipa, where patients are currently sleeping in corridors. Mr. Speaker, sir, through you, let me provide an update to say, due to funds, indeed the project was stopped, but the project will continue and will ensure that the people of Chitipa, the male ward, is completely rehabilitated and people will go back to sleeping properly within the wards. The process may take time, but it's for the good of the district hospital because the renovation will help to improve the facility and will ensure that it is done. Mr. Speaker, I would also like to thank the honorable member from Neno East, where she asked about the consideration on the upgrading of a community, of a health facility to a community hospital and what exactly it takes for a hospital to be upgraded to a community hospital. Mr. Speaker, sir, through you, let me advise the honorable member and also honorable members who are here in the August House to say there are a number of considerations that are put in place to ensure that a health facility or health center is upgraded to a community hospital. And one of the requirements is that the facility should have proper housing for workers that will be working at the facility. And the housing, we are talking of more than 30 houses. That has to be there because of the nature of community hospital and the services that are provided at a community hospital. Mr. Speaker, sir, let me also advise that we also consider the catchment area around the community hospital. We recommend that the community hospital should have health facilities that would be feeding into the community hospital that are around the area. So it should not be an isolated place, but rather a central place where other health centers can input or can feed into the community hospital. And again, we consider issues of theater, access to theater. We consider issues of maternal. We consider issues of transportation, that all these have to be considered. When we look at a community hospital, Mr. Speaker, sir, it is a place where all services, where even doctors, specialists are found. And it is a place that has to have enough space where construction of all these construction and theaters, wards, and everything else has to be able to be constructed. So I would like to advise the honorable member for Neno East to visit my office so that we can together assess this site and recommend if it is fit for a community hospital. Thank you, Mr. Speaker, sir.
Thank you, Minister of Health. Mwanza Central, I got your note. Yours was question 70. I hope you have brought us some tangerines from Mwanza.
Yeah, they're in the car.
Okay. All right, Mwanza Central, please confirm question 70.
Thank you very much, Right Honorable Speaker. I rise to confirm that question 70, standing under my name, is indeed from Mwanza Central constituency, and your tangerines are in my vehicle, Right Honorable Speaker. Thank you.
Thank you, Mwanza Central. Honorable Minister of Health.
Thank you, Mr. Speaker. And through you, let me thank the honorable member for Mwanza Central for his question, which is to ask the Ministry of Health and Sanitation on the immediate steps the ministry is taking to provide Mwanza Hospital, District Hospital, with a new fully functional X-ray machine and to ensure that critical diagnostic services are restored. The restoration of the mentioned facility could also reduce the long-distance travel for patients to access basic care. Mr. Speaker, sir, my ministry is fully aware of the breakdown of the main X-ray machine at Mwanza District Hospital. We recognize the impact this has and has had on the diagnostic services and have been working tirelessly to restore full functionality and ensure uninterrupted access to essential imaging services at Mwanza District Hospital. Mr. Speaker, sir, allow me to outline steps that have been taken so far. On 29th December 2024, the ministry procured and delivered a mobile chest X-ray machine through the USAID-funded Tuberculosis Implementation Framework Agreement project. This machine operates with the district mobile clinic at the moment, which is also called Chipatala Choenda Enda, providing outreach diagnostic services. On 9 December, my ministry deployed an additional digital X-ray machine for use within Mwanza District Hospital, and though functional, this machine has limited capacity due to its smaller size. On 23 January 2025, my ministry procured and deployed a new ultrasound scanning machine, which is currently operational and supporting patients with essential diagnostic services. In July 2025, my ministry undertook site assessments, including obtaining technical specifications and room measurements in the radiology department at Mwanza District Hospital in preparation for the installation of a new fixed X-ray machine. Mr. Speaker, sir, Mwanza District Hospital is among 18 facilities earmarked to benefit from the fixed X-ray machines procured through the Global Fund, which are now awaiting delivery. Mr. Speaker, sir, when X-ray services fail at Mwanza District Hospital, patients are indeed forced to travel as far as Rusungwe, which is unacceptable. This is why the ministry is committed to installing a high-capacity, reliable fixed X-ray machine. Importantly, the machine will be placed under a service agreement of at least 3 to 5 years to prevent service interruptions due to equipment breakdowns. And my ministry is advocating for all major diagnostic equipment to be placed under such agreements. Furthermore, Mwanza District Hospital received a biomedical engineer in September 2025. My ministry is collaborating with partners to build local capacity so that minor technical issues can be resolved within the district without relying on central level support. Mr. Speaker, sir, the honorable member has raised a very important issue regarding access to diagnostic services. I would like to encourage the honorable member to consider supporting strengthening of diagnostic capacity within the constituency should local resources become available, particularly for empowering the biomedical engineer. I thank you, Mr. Speaker, sir.
Thank you, Honorable Minister. And I start with Cholo Tekerani.
Thank you so much, Right Honorable Speaker, sir, for recognizing the people of Choro Tegeran to ask the Minister of Health a supplementary question. Madam Minister, X-ray machine at Tegerani Rural Hospital is still idle. It was planted 2 years ago, commissioned, but up to now, the machine is not used. The issue surrounding not using the machine are not understandable because the machines are modern, they were planted, but they're just saying radiation, radiation, radiation. But
what are they saying?
The issue surrounding the not starting using the X-ray machines, we are just hearing that is the issue of radiation. Yeah, so we just want to find out from the minister, when is the machine, the X-ray machine, going to be used? Because it has taken a long time since the machine was planted at Tegerani Rural Hospital. Thank you so much, Right Honorable Speaker, sir.
Thank you, Cholo Tekerani. Indeed, that machine needs to start working. Let me take Mangochi West.
Thank you, Right Honorable Speaker, for this chance for the people of Mangochi West to ask a supplementary question to the Minister of Health. Through you, Right Honorable Speaker, the people of Mangochi West would like to know the factors which the Minister do consider for it to upgrade a district hospital into a central hospital. We are asking this question having in mind Mangochi District Hospital, which attend more patients more than other central hospitals, and it being a tourist destination district, I hope our visitors could be assured of good treatment if it can be transformed into a central hospital. Therefore, Madam Minister, what factors or criteria is being considered for a district hospital to be upgraded to a central hospital? Thank you, Right Honorable Speaker, sir.
Thank you. I see Zuzu City. Is it south? Southeast. You're raising a point of order. Go ahead. Mzuzu City South, I've given you the floor. Make use of it. Press the mic.
All right, thank you, Right Honorable Speaker, sir, for allowing people of Mzuzu City Southeast under the leadership of Tie Tula, Jivesh Goamo, Kamshibazi, Kaula, Shkundula, Mafuta, and our loved block leader, Bambe, to ask a supplementary question to Honorable Minister of Health. I would like to request if our Honorable Minister of Health can consider people from Zuzu City Southeast, if at Mapari Health Center, if we can have a theater room and with a full equipment. And also I would like to ask Honorable Minister of Health if they can also consider us with a good big treatment room at Mapale Health Center, because the one that we have is too small, that is not allowing to accommodate more than maybe 100 patients. So if your Honorable Minister of Health can consider us with this, we can appreciate. I thank you, Right Honorable Speaker, sir.
Thank you, Mzuzu City South, Minister of Health.
Thank you, Mr. Speaker, sir. And through you, let me thank the honorable member from Cholo Tekelani, who asked about an X-ray machine at Tekelani, which is lying idle at the moment, and is requesting and asking the ministry why it is still idle, and if it can be commissioned so that it should be used. Mr. Speaker, sir, through you, let me say to the honorable member that X-ray at Cholo Tekelani, which is lying idle at the moment, I'll make sure that I personally take it up to find out why it is lying idle. At the moment, there has to be a technical explanation why the X-ray is still idle, other than maybe just the radiation issues that are being asked or that are being mentioned at the hospital. So I'm inviting the honorable member for a cup of coffee so that after I find out, I can share why it is idle, and will ensure as a ministry that it is commissioned and it is in use. Mr. Speaker, sir, let me also thank the honorable member for Mangochi West, who has brought up a very critical issue and asking my ministry what are the factors that we consider to upgrade a district hospital to a central hospital, and he is requesting if Mangochi can be upgraded to a central hospital. Mr. Speaker, sir, this is a very critical and a very big issue that has to be considered. And as critical and important as it is, I would like to advise the honorable member that he should come up with its own request so that I can properly consider bringing it as with a separate response with more details on why we have the central hospitals that we have and what we can do and the processes that are currently being undertaken to ensure that Mangochi Hospital is upgraded, and also the challenges that are there at the moment. Mr. Speaker, sir, I'm also thanking the Honorable Member from Zuzu City Southeast for the question to my ministry, where he's asking for a theater and equipment at Mapale Community and Urban Hospital, which currently is serving a large population within Mzuzu City. Mr. Speaker, sir, indeed Mapale Community Hospital is one of the strategic community hospitals serving a larger population within the urban area in the city of Mzuzu. And my ministry, having noticed that, we allocated funds under the presidential initiative on maternal health, where maternity wing is being constructed, and I'm happy to report that the theater is under this plan. I visited Mapale it was in February this year, and I would like to assure the people of Mzuzu City Southeast that we are considering the construction of this theater and also modern equipment to ensure that Mapale is able to respond to the health needs of our women in Mzuzu City. Thank you, Mr. Speaker.
Thank you, our Minister of Health. Cholo Tegerani, you're supposed to go for a cup of coffee. Set a date so that I know the able minister will be there within a week. That radiation issue should go away. Yes, please. It's 15:30. We are going up to 15:35 so that we exhaust the remaining 5 minutes on question time. Is that okay, Leader? Okay. Thank you. We now move to question 109 in today's order paper, coming from the people of Doangala. Doangala, are you in the house? Please confirm.
Thank you, Right Honorable Speaker. I rise to confirm that question 109 appearing on order paper is indeed coming from the people of Senior Chief Chakaza and Saptie Mulalo. Thank you.
Thank you. Minister of Health.
Thank you, Mr. Speaker. And through you, let me thank the honorable member for the question, which is to ask the Minister of Health and Sanitation when construction of hospitals at Kachigamba and Tsukamakoza will resume. Mr. Speaker, sir, I would like Mr. Speaker, sir, the House may wish to note that the facilities at Kachigamba and Sukamakoza were constructed some time ago as lower level health facilities, namely a health post and an under 5 clinic respectively. Due to their age, limited scope, and prolonged use without major rehabilitation, these structures are currently not in good condition and are unable to adequately meet the health needs of the growing population in their catchment areas. Mr. Speaker, sir, with regard to Kachigamba, the facility serves a population of approximately 9,051 people. The nearest public health facility is Chizolo Wondo Health Center, which is about 21 kilometers away. The area is classified as hard to reach, characterized by difficult terrain and geographical barriers, which severely constrain access to essential health services. And in view of the high population, long distance to the nearest facility, the geographical challenges, my ministry acknowledges the need to upgrade Kachigamba Health Post to a fully fledged health center in order to improve access to comprehensive primary healthcare services. Similarly, Mr. Speaker, sir, Tsuka Makosa is currently operating as an under 5 clinic, serving a catchment population of about 4,200 people. The nearest public health facility is Chakaza Health Center, located approximately 13 kilometers away. Considering the population size and the distance to the nearest health center, the ministry recognizes that the current level of services at Ntsukamakoza is inadequate. As such, there is a clear need to rehabilitate and upgrade Ntsukamakoza Clinic into a health post so that it can provide a wider range of essential health services. Mr. Speaker, sir, I'm pleased to report that the two facilities are already included in the Integrated Capital Investment Plan, where we will be leveraging on additional resources within the district council. As such, I'm encouraging the honorable member to prioritize these facilities under the CDF at the district council to support further development and completion. I thank you, Mr. Speaker, sir.
Thank you, Minister of Health. Lilongwe City, is it the Honorable Jonathan? Unfortunately, my screen is not showing the full name. Zenza. Yes, you have the floor.
Thank you, Honorable Speaker, for recognizing the people of Lilongwe City, Zenza, to ask the Honorable Minister a supplementary question. Honorable Speaker, I must firstly commend the Minister, because last week they were in my constituency launching the lenacapavir drug, which I feel most of the people, including the media houses, are failing to pick that as a drug. They are basically thinking it's a vaccine, of which maybe even some of the members here might also think the same. So what I wanted to ask the minister is, if possible, there's need for more civic education to the masses, because it seems if even the media houses are saying this is a vaccine when it's a drug, then we might be misleading the people around us, which is not good. So my request to the minister is to consider using whatever means possible to civic educate the masses so that they understand this is a drug which is taken twice a year, to say maybe every 6 months, so that it helps each one of us, because I think even some of us will need it. We haven't gotten it, but we might need it. It's good for us. I beg to submit.
Thank you. Karonga Songwe.
Thank you, Mr. Speaker, sir, for giving opportunity to the people of Kalonga Songwe to ask a supplementary question to the Minister of Health. Mr. Speaker, sir, I'd like to ask the Minister of Health to consider constructing a health center at the Kasangani in GVH Liamayolo. As I'm speaking, Mr. Speaker, sir, the people of the lower Songo from GVH, Liamayolo, Mwangukuru, Mwakamogo, they are moving a long distance to access the health services. Thank you, Mr. Speaker. Sir.
Thank you. Cheo Central.
Thank you, Right Honorable Speaker, for recognizing the people of Nchew Central East. I want to find out from the Honorable Minister. In fact, I'm coming from Nchew Central East, and Nchew District Hospital is very far. It's in the peripheral area of my constituency. The nearest district hospital is Baraka. So I'm wondering what happens, especially if we refer our patients to Baraka District Hospital. If these patients have been referred to Baraka District Hospital, those patients who are very serious, they are told to tell their member of parliament to ferry those patients from Baraka District Hospital to Zomba. I want to find out from the minister if he's aware about this. Thank you.
Honorable Minister, allow me to take one last one from the Zaranyama. He's been wanting to say something, and then you can respond to those. Deza Zaranyama?
Thank you very much, Mr. Speaker, for recognizing the people of the Zaranyama constituency. The people of the Zaranyama would like to ask or request the Minister of Health when the Minister is going to open the Jamhi Health Center, which was constructed some 3 years ago by the Minister of Health itself with the funds from global funds. Thank you, Mr. Speaker, sir.
Thank you very much, Minister of Health.
Thank you so much, Mr. Speaker, sir. Let me thank the honorable member for Lilongwe Citizens for his question. The question was to ask the Minister of Health to consider civic education on the lenacapavir injections that were launched last week at his constituency. Mr. Speaker, sir, indeed, first let me thank the honorable member for this question and also for welcoming us at his constituency where my ministry launched the long-acting injection called lenacapavir, which is one of the HIV prevention options that we already have and is added on to that list. Mr. Speaker, sir, indeed, civic education is a requirement, and my ministry has already put in place a number of ways on how to reach out to the masses on how this is being administered and who is required to access lenacapavir. And indeed, as he has rightly said, lenacapavir is not a vaccine, Mr. Speaker, sir. It is a treatment. And for you to receive this treatment, Mr. Speaker, sir, you have to be assessed. It's not that you just go to the hospital and receive this treatment. So you are assessed if you are at risk of contacting HIV. And you are only provided if the health worker assesses that indeed you are at high risk, number one. You are also provided if you are HIV negative, and it's provided every 6 months. So we are conducting several, we're using several media houses, we're using CSOs, we're using local community radios, and even local means to make sure that we are reaching out to a number of people. And actually, this injection called lenacapavir that is administered every 6 months, Mr. Speaker, sir, we had another one that was launched in 2023 called Kabla, that was being administered every 2 months, which has been there. And also we had oral PrEP that was being administered since 2019. And Mr. Speaker, sir, already because of the civic education that is out there, we've noted a number of people, majority of Malawians have gotten to know about lenacapavir and have gotten to understand, and also we've raised demand for people, especially key populations that are at risk. And these are mostly like people like sex workers, those that have multiple partners, women that are pregnant, and many other people that are at risk. So thanks to the honorable member, we will indeed ensure that we continue to sensitize the masses on this. Mr. Speaker, sir, through you, let me also thank the honorable member for Karonga Songwe for his question, which is for the ministry to consider construction of Kasangani Health Center. Mr. Speaker, sir, indeed, Kasangani Health Center is included in our capital investment plan, and we are encouraging the honorable member to consider prioritizing it under the CDF. As he is aware, resources have been decentralized to the district councils, and if this is prioritized, indeed the people of Kalonga Songwe will have a new Kasangani Health Center. Mr. Speaker, sir, let me also thank the honorable member from Ncheu Central East, who spoke with power and asked the Minister of Health and Sanitation if she is aware that people from Ncheu Central East are being referred back when they go to Balaka, which is the nearest district hospital. Mr. Speaker, sir, I would like to let the honorable member that the minister has taken note of this matter that is concerning to the people of Ncheu Central East, and we will seriously take it up. We will discuss. We want to make sure that the people of Ncheu Central East have access to nearest referral hospital, and they have access to health services at a nearby place. Mr. Speaker, sir, I would also like to thank the honorable member for Deza Zananyama, who asked my ministry to consider completion of Yambi that was constructed years ago but was not completed. Mr. Speaker, sir, indeed there were several projects that were started. If this can be prioritized, the people of Desert Zananyama will have access to a finished Yambi Health Center. Thank you, Mr. Speaker, sir.
Thank you, Honorable Minister, for those replies. Honorable members, it's now 15:48. Time for health break. We go for health break and we'll be back at 16:50. 1618? 1628? No, 1618. 1618, House suspended.